This presentation is specifically aimed at investigators who will be looking after neonates. This information should be listened to alongside the other recovery training documents. This presentation has been updated in February 2021, which takes account of some important protocol changes. Transmission of COVID-19 from a mother to her unborn baby is very unlikely, and there is a low risk of babies being infected at birth, even if born to a confirmed COVID-19 positive mother. Infection in the neonatal period, that is less than 28 days of age, has been described, but is very rare. The majority of babies who develop COVID-19 present with mild symptoms or are asymptomatic. Babies with symptoms may present days to weeks after birth. Up to the age of 44 weeks corrected gestational age, clinicians may choose to treat infants of any gestation on the basis of clinical signs alone if there's a high index of suspicion for COVID-19 infection. This may especially be the case where clinical deterioration is not explained by existing neonatal conditions. Where the cause of the clinical deterioration or collapse is unknown, the possibility of COVID-19 infection should be considered. For the few infants who develop suspected or confirmed infection, a robust evidence base is essential to guide the use of effective treatments and to avoid potential harm from severe or life-threatening disease. The Royal College of Paediatrics and Child Health recommend that treatments for COVID-19 should only be used in the context of a treatment trial. It is anticipated that any child with suspicion of COVID-19 being considered for treatment over and above supportive care should be enrolled in the recovery trial. Criteria for treating infants who are less than 44 weeks corrected gestational age include the following. They should also be considered as criteria for entry to recovery for these same infants. An increase in respiratory support to maintain oxygen saturations within accepted limits, that is new or above a baby's previous baseline. Signs of sepsis with shock, encephalopathy, multi-organ failure. Patient information leaflet and consent. Parents of infants being considered for recovery should be provided with an information leaflet. Bear in mind this details treatment in older children and those children with PIMS-TS as well. The parent or guardian should sign the consent form. Witness consent may be obtained over the telephone or via web link if hospital visiting rules or parental infection mean that a parent or guardian cannot physically be present. Treatment for infants less than 44 weeks corrected gestational age. The following treatment options are open to infants less than 44 weeks corrected gestational age. Randomisation 1A includes hydrocortisone versus no additional treatment. There are no options open within randomisation 1B. Please note that the hydrocortisone option is specific to infants less than 44 weeks corrected gestational age and is not available to older infants and children, and indeed not open to adults. There is no options available within the second randomisation, that is tocilizumab versus anakinra versus no additional treatment, because these options are only open to children who are older than 1 year of age. Therefore, it's not relevant to this population. Specific neonatal drug dosing and administration information is available within the Frequently Asked Questions document on the Recovery website. Thank you for listening to this presentation.